Namaskar. We all know in mathematics 1 plus 1 is equal to 2. But we also know in society, in culture, in academics, in discipline, at the workplace, 1 plus 1 may be 11. And that is the strength of unity. These relationships also exist in pharmacology regarding drugs. If we are using 2 or more drugs to treat a patient, in that condition, the effect of these 2 drugs or more than 2 drugs may be equal to 1 plus 1, that is the 2, or it may be 1 plus 1 more than 2, or it may be 1 plus 1 less than 2. And this relationship is studied under a topic that is called combined effect of drugs. And our today's topic is combined effect of drugs. Usually, 2 or more drugs are administered in different dosage form at one time, or it may be administered in a single dosage form at one time. If it is administered in a single dosage form, then it is called fixed dose combination. And main purpose to use more drugs at one time to treat a patient is, number 1, it increases the therapeutic effect of the drugs or therapeutic value of the drugs. It decreases dose of individual drugs. It decreases side effect of individual drugs. It improves patient compliance. It is more convenient for a patient to take a medicine at one time, and it reduces the medication errors. These are the main advantages for this combined effect of drugs or the fixed dose combinations. Now, this combined effect of drugs can be studied under 4 headings. Number 1 is additive effect, number 2 is the synergistic effect, number 3 is the potentiation effect, and number 4 is the antagonistic effect. I am repeating: additive effect, synergistic effect, potentiation effect, and antagonistic effect. Now we will try to understand these terms one by one. What is additive effects? Suppose we are using 2 or more drugs at one time, and their combined effect is equal to sum of the individual drugs effect. If it is equal to sum of the individual drug effects, then it is called the additive effects. For example, we are using 2 drugs, drug A and drug B. Suppose drug A kills 40 bacterial cells and drug B kills 60 bacterial cells. We are combining drug A and drug B and administering to a patient, and it is destroying 100 bacterial cells, then it will come under the category of the additive effects. I am repeating, additive effects means a combined effect of the drug is equal to sum of the individual drugs effect. Because it is sum of the individual drug effects, it is also called summation effect. Means additive effects is also known as the summation effect. But usually it rarely happens when we are applying 2 drugs at a time and they are producing the additive effects. There may be variation in this effect. It may be more than the additive effects, or it may be less than the additive effects. If it is more than additive effects, then it is called the synergistic effect. And if it is less than the additive effects, then it is called the potentiation effect. Before studying this synergistic effect, we will try to understand some examples of the additive effects. Number one example is, the most common example is use of aspirin with the paracetamol. Usually they produce the additive effects. Second example is use of ephedrine plus theophylline to treat the bronchitis. So these are the main two examples of the additive effects. Now will come the next term, that is the synergistic effect. Word synergistic is from the two words. Number one is the syn and number two is the ergos. Syn means together or ergon means work, or synergistic means work together. If we are defining this synergistic effect, then it will be effect of the two or more drug is more than their sum of the individual effect. Or you can say, if the therapeutic effect of the two or more drug is more than their additive effect, then it is called the synergistic effect. I am repeating, there are two definitions of the synergistic effect. Number one is the effect of your combined effect of the drugs is more than sum of the individual drug effect, then it is called the synergistic effect. Usually, synergistic effect is produced by the drugs that act, or those drugs that act at the one target or at the one type of cells or by the one mechanism pathway. Means both drugs are affecting one target, or both drugs are affecting one type of cells, or both drugs are acting through similar mechanism of action, and in that case this drug may produce the synergistic effect. For example, cotrimoxazole, that is the combination of the sulfamethoxazole and trimethoprim. There are various other examples. This synergistic effect is used usually in three classes of the drugs. Suppose the drug is safe, but that drug is unable to produce the therapeutic effect. In that condition, drug may be used with another drug by producing the synergistic effect. Number two, suppose a drug is strong, but it has a high toxic effect or it has more side effect. In that condition, that drug can be combined with the other drugs that will improve the therapeutic effect of this drug and that will reduce the side effect of this drug. And third category is one drug reduce the workload of the other drug. One drug reduce the workload of the other drug. In that condition, that combined effect, the combination of two drugs may produce the synergistic effect. For example, there is one drug, levodopa. We all know levodopa is a dopaminergic drug, and levodopa is inside the body stimulate dopaminergic receptors, and it is metabolized by the enzyme inside the body. Similarly, there is one drug that is bromocriptine. Means combination of the levodopa and bromocriptine is used as a synergy to produce the synergistic effect. This bromocriptine is a weak drug and it also stimulates the dopaminergic receptors, but individually it cannot produce the therapeutic effect because it is the weak drug. If it is used with the levodopa, both are the stimulating dopaminergic receptors, the combination will increase the therapeutic effect of these drugs and it will decrease the dose of both drugs, and because dose of the both drugs is decreased, it will reduce the side effect of these drugs. Means a combination of the levodopa and bromocriptine is considered as a synergistic effect. We can take another examples. We know there is a one drug or we know hypoglycemic agents. Hypoglycemic agents are used to reduce the blood glucose level. There are various hypoglycemic agents like insulin. There is another drug that is called the Aravacos. It is not on the board. Okay, it is not on the board. Aravacos. Aravacos block the absorption of the glucose. Because it blocks the absorption of glucose from the GIT, automatically blood glucose level will decrease. Thus, the hypoglycemic agent dose will be reduced, and after reducing dose, it will produce the equal effect, means it will maintain the blood glucose level. So these are the two examples of the synergistic effect. This synergistic effect is also called super additive effect or supra additive effect or potentiation effect or augmentation effect or coalescence effect. And these effects are used in the pharmacology to improve the therapeutic value of the drugs. But it will just opposite in the toxicology. Suppose we are using two toxic drugs or two toxic drugs enter inside our body. In that condition, these toxic drugs may increase the toxicity of each other. And this increase will also come under the category of the synergistic effect. And that will produce the harmful effect, that will produce the toxic effect that may be lethal in nature. Means if synergistic effect we are using in the pharmacology to improve the therapeutic value, to decrease the dose of the drug or to decrease the side effect of the drug, that is the useful, that is the beneficial. But this effect, if it is in the toxicology, it will be harmful for the patient. Examples in toxicology. We all know barbiturates are CNS depressant. If these barbiturates are used with another sedative drugs, another hypnotic drugs, another anesthetic drugs, or alcohol, or narcotic analgesics, or general anesthetics, these all reduce the CNS, these all called the CNS depression. And if barbiturate is used with these drugs, it will produce the CNS depression, it will produce the synergistic effect, and that will be maybe lethal in nature, that will be toxic in nature. Means this synergistic effect in pharmacology we are using for the beneficial effect, but if it happen in the toxicology, it will be harmful, it will be poisonous, it will be lethal for the human beings. Another example, we all know smokers are prone to cancer. Means cancer very easily develop inside the smoker's body. If a person is a smoker and working in an environment having lot of asbestos pollution or asbestos fiber in the atmosphere, in that condition, the chances of the lungs cancer will be higher in the smoker than the non-smokers. This is the synergistic effect. Now, in the starting we studies, there are four effects in this category. Combined effect of drugs. There are four combined effect of drugs. Number one is the synergistic effect. Number two is the potentiation effect. Number three is the additive effects. And number four is the antagonistic effect. We have studied the synergistic effect and we have studied the additive effects. Now, when we are using the synonym of the synergistic effect, we use different names like super additive effect or supra additive effect or potentiation effect or augmentation effect or coalescence effect. in this world there is a potentiation effect. Potentiation effect also produces the synergistic effect. But in pharmacology, we use these two terms for the different situations. Number one is the synergistic effect, and another situation is it will be called potentiation effect. Now we'll try to understand what is potentiation effect. Suppose we are using two drugs. One is therapeutically active and another one is the therapeutically inactive. And the action is more than the additive effect. What was in the synergistic effect? We are using the two drugs and both are the therapeutically active, and synergistic effect will produce the more therapeutic effect or more therapeutic value. But in potentiation, one drug will be therapeutically active, another drug will be therapeutically inactive. And if we are combining this drug, it will produce the action that will be the more than the additive action. Means 1 plus 0 will be more than 1. Then it is called potentiation effect. There are several examples of the potentiation effect. Very common example is the levodopa and carbidopa. There is two words, levodopa and the carbidopa. We all know levodopa inside our body convert levodopa into the dopamine, and that dopamine act on the dopaminergic receptors. But this dopamine cannot cross the blood-brain barrier. Now, it means person is suffering from the dopaminergic receptors problem in the CNS. In that condition, this levodopa will not be effective because body converts this levodopa into the dopamine, and dopamine cannot cross the blood-brain barrier. Means the levodopa we are administering cannot enter into the brain or inside the CNS. Here we are using the carbidopa. This carbidopa prevent metabolization of the levodopa or block conversion of levodopa into the carbidopa inside the periphery of the human body. Then what will happen? Levodopa can cross the blood-brain barrier. Remember, levodopa can cross the blood-brain barrier, but dopamine cannot cross the blood-brain barrier. Now, this levodopa is protected to be converted into dopamine in the periphery of the body by the carbidopa. Carbidopa is not producing any therapeutic effect. It is only blocking the conversion of the levodopa into the dopamine, and levodopa enter inside the blood-brain barrier, across the blood-brain barrier, enter into CNS, and CNS will convert this levodopa into the dopamine, and it will affect or it will treat the disease that is due to the dopaminergic receptors problem. For example, Parkinson's disease. Here carbidopa has no therapeutic value, and this combination will come under the category of the potentiation effect or potentiation mechanism. Now, there is another difference between the synergistic effect and the potentiation effect. In synergistic effect, drugs act on a single target or drugs act on a single type of cells or drugs act through one mechanism. But in potentiation, drugs act at the different organs, different targets, or different mechanism of action or different type of cells, and it produces the therapeutic effect. Here in synergistic effect, producing the therapeutic effect by acting one type of cells, one type of target or one type of mechanism. But in potentiation effect, they are producing the therapeutic effect by acting different targets, different cells or different mechanism. And this will also increasing the effect that is the more than the additive effect. But it will come under the category of potentiation effect, and that will come under the category of the synergistic effect. And last is the antagonistic effect. Very simple, very clear. Antagonistic effect means when we are combining the two drugs and both drugs are acting opposite to each other, that action will call as the antagonistic effect. And these all are about the combined effect of drugs. It is a very important topic because in today's scenario, very little new drugs are coming in the market. And resistance of the disease or resistance of the bacteria or the problem of the bacteria of the body is increasing. To solve this problem, we are using the combined effect of drug so that without using the new drug, we can produce the better therapeutic value, reduce the side effect of the drug and reduce the dose of the drug. Hope I will be able to clarify this point. If you are agree with this discussion, that combined effect of the drug or administration of the two or more drugs at one time is a better choice than using the single drug, put yes in the comment box. And if you do not agree with this explanation and you think use of the single drug is better choice than the use of the combination of the drug, then put the comment box no. There is another videos that explain why this fixed dose combination is better or why this fixed dose combination should not be used. I will put that link in the comment box. You can watch there why this fixed dose combination is not good or why this fixed combination is good. Thank you very much for viewing this video. Thanks a lot.